Hello, today we're going to do a postpartum assessment on our patient. I've done my hand hygiene, I've done my general principles and safety practices. I've done my 2 patient identifiers, name and date of birth. I would do a full complete set of vitals on his patient and record those. First, I'm going to start with the breast, and I will uncover, keeping just enough uncovered for privacy. When I'm looking at the breast, I'm looking for engorgements, I'm looking for nipples that might have cracks around them. If this patient, especially if she is lactating, breastfeeding, if she's not, well, I'm going to ask her about pain. If she's in pain, if she's 0 to 10 being the worst, I'm going to ask her if she's wearing a good support. I'm going to let her know and teach her about support, so supportive bra while she's breastfeeding or not breastfeeding. Also want to let her know that the stimulation of the breast, not to do that while she is not breastfeeding. So once I'm done, I will cover her back up. I'm going to the bladder and the bowel area. Coming to the bladder and bowel area, I'm doing that so that I can listen to the bowel sounds prior to pushing anything on the uterus or anything or the fundus. So I'm looking to see if her bladder is distended. I want to tell her the importance of keeping track of urine, how much she's urinating. I apologize, my voice is about to leave. Let her know that, measurement occurrences and things like that are important. I'm going to ask her at this time if she's having bowel movements or if she's just expelling gas. I'm going to listen to the bowel sounds. Okay, all those are active in all 4 quadrants. After that, I want to move back up to the fundus in the uterus. To do so, I'm going to make sure that it's not flabby or flappy and it's not real soft and it's firm. I'm going to palpate that by putting my hand just supporting it at the pubic area here, just above the pubic area, feeling just above the umbilicus and find where the uterus is at. I want to palpate that, like I said, checking to make sure that it's firm and that kind of thing. I want to ask her if she's in any pain when I do so. 0 to 10, obviously our pain scale. When I'm doing that, I'm checking for the height, the position, how it does feel. If it was flabby, I would sit, I would massage it, do a fundal massage. She's in pretty good shape, so we won't do that today. Then after I do that, I'm going down here to the lower area. Actually, let's roll our patient and see, make sure that she's not hemorrhaging or anything like that. So when I roll my patient, I'm looking at the chucks and the pads. I want to see the color, if there's any odor to it, which may indicate some type of infection or whatever. I want to ask her how often she's changing her pads per day, or throughout the day. I want to ask, is she in any discomfort or anything like that. I'm also going to do her H&H. I want to find out what her blood type is. I want to check her RH factors, and also want to do a rubella titer on her. Once I have all that completed, I want to move to the perineum area. I'm going to remove the pad front to back. I'm going to assess that pad, see how dark, how light, how much is in it. I want to assess the perineal area for if she's had episiotomy, and make sure that it's all good. I want excuse me. I want to instruct her to use a peri bottle to clean with. We don't want her just really drying off real good. I just want to pat dry that. We don't want to disrupt anything because if she has had a episiotomy, she's going to have some stitches there. Once I have all that done, I'm going to put a pad back on, and we're going to put it back on front to back. Once I do that, we are going to roll down here to the lower extremities. I'm checking for some edema and that kind of thing. Also going to check for a thrombus. I'm going to use the Holmes method. I'm going to check muscle retraction and that kind of thing. Ask her again if she's in any pain. Pain is something we want to assess through postpartum. Oftentimes women do experience some different pains and stuff, so we want to make sure we assess that. Once I have that done, then I want to ask her, you know, how's her support system, her family, her friends, does she need anything? And if she does, we'll get that for her. Or if there's any other thing I need to do, make recommendations or anything like that, you know, I can do so at this time. At this time, I'm done with my postpartum